Healthy Living in the Four Corners is brought to you by Southwest Eye Consultants. You're watching Healthy Living in the Four Corners. I'm Deborah Uroda. Philosophers throughout time have said, in one way or another, that our eyes are the windows to our innermost selves. What they didn't know is that our eyes also are a window into our health. They are the one organ where medical professionals can look inside the body to examine the blood vessels and nerves that make us tick. Durango ophthalmologist Mas Fenberg with Southwest Retina Consultants says our eyes also are one of the first organs to experience the effects of high blood pressure, the silent killer that, if undetected, can lead to heart attacks, stroke, and eventually death.
One of the greatest concerns outside of eyes is the risk for stroke and heart attack with high blood pressure. So if you can catch these symptoms early, when you are seeing it in the smaller vessels, in a place that you can look into the body in a way that you can't look into the cerebral vasculature or the cardiac vasculature without an angiographic study, and you can say, listen, I'm not sure that your blood pressure is under as good a control as you think it is. Or you can communicate with the family physician and say, there's significant changes in the eye. They are at risk for more significant systemic problems.
One of the first signs that you may have high blood pressure are swollen arteries, the transportation system that pumps blood into your eye.
The artery is what is dealing with the higher pressure. The vein is relatively weak. The artery is pulsatile and pressure is going through it quite quickly. The vein just has valves and flows passively. Arteries cross veins. And as those arteries cross the vein and the artery is dealing with a higher pressure, the artery crushes the vein. And that's called AV nicking. And so we see that inside the eye, arteriovenous crossings where the vein is just squeezed out and the artery is compressing it. That's a normal physiologic response to higher pressure. The artery is getting stronger to deal with that. And so when we see those early changes, that can be an indication that more changes are happening down the road.
If left untreated, your high blood pressure may manifest itself first as a stroke inside the eyeball.
Stroke is essentially an interruption of blood flow, either because of a bleed or because of a clot. And in the retinal distribution, there are several conditions: retinal vein occlusion and retinal artery occlusion. And then there are divisions of central versus branch. And so if you have a central retinal artery occlusion, it is a painless, sudden vision loss. In the same way that you can have a central retinal artery occlusion, you can have a branch retinal artery occlusion, whereby instead of having complete vision loss, you have hemifield vision loss. One side or the other is lost. In general, the treatment for a central retinal artery occlusion or a blockage of all the blood flow to the eye is an ocular procedure here in the office that's similar to CPR. It's a small effort with pressure on the eye and sometimes a lowering of the pressure within the eye via draining a little bit of fluid to push a clot downstream. So if it's in the central trunk of the vascular tree, to try to push it further to a branch or to a tributary.
Another complication that may arise if you don't keep your blood pressure in check is a clogged vein that won't allow the blood feeding your eye to recirculate to the heart and lungs.
I describe it like a bathtub. There's a spigot and there's a drain, or there's a faucet and there's a drain. Blood is coming in and blood is draining. We've obstructed the drain, and so the bathtub starts to fill up. And so what we see is macular edema. The eye gets really marshy and boggy and swollen, and that's very treatable. So there are intraocular injections. I know that terrifies people to think about, but there are intraocular injections where we basically place a medicine into the eye that reverses the body's tendency to leak. It suppresses that tendency for the vessels to leak. And so you can treat with vascular growth factor drugs, which I know is a mouthful, but these growth factor blocking drugs suppress that. You can treat with good old steroids, and those do a great job. You can treat with laser. Those help as well. Most importantly, what you don't want to do is ever throw the towel in on your eye. Patients often will feel that, okay, I've lost vision. I've got the other eye. I've got the other eye. I'm fine. Well, you're at risk for the same problem in the other eye. And if you live long enough, statistically, there's a chance that you'll have that problem. We have patients who formerly had a bad eye and a good eye, and then they had a more serious complication in their good eye, and now their bad eye is their good eye. So that's What you don't want to do is say, well, I've got a good eye still, because you do want to maintain as much as you can, even though it may be your spare tire and you may not be relying on it and you wouldn't really want to have that as your good eye, as your only eye. You may live another 20 years. You may have a problem with your good eye. So important to have follow-up, important to make sure that you do limit your systemic risk factors, but you also follow the ophthalmic side of it as well.
If you'd like to know more about the effects of high blood pressure on your eyes, contact Dr. Fenberg at Southwest Eye Consultants, swiconsultants.com. I'm Deborah Uroda for Healthy Living.